I'm Crispino Nunes. India is battling the second wave of the COVID-19 pandemic. The government has stepped up measures to fight the virus, from expanded vaccination drives to initiatives to ensure medical oxygen supply demands are met across the nation. With several cities entering a lockdown to stem the advance of COVID, India is stepping up all measures in its fight back. Republic TV keeps you ahead on the latest from every state and every city. Our reporters covering all information on the ground will keep you up to date with all the latest. Well, joining me on the broadcast are my colleagues Amandeep live from Chandigarh, Gursimran from Jammu, Mahima from Daryaganj. Good morning to all of you. Mahima, I'd like to start with you first. Delhi is under a 6-day lockdown. What are the scenes that you are witnessing since yesterday's announcement by Chief Minister Arvind Kejriwal?
Well, absolutely. The Delhi is under 6-day lockdown. The announcement that came yesterday by Delhi Chief Minister Arvind Kejriwal. We are present at the Daryaganj market, Crispino, and clearly you can see that how the market wears the deserted look, announcing a 6-day lockdown in Delhi from 10 p.m. on Monday to 5 a.m. next Monday. Chief Minister Arvind Kejriwal clearly stated that the move was necessary as the rising COVID cases had severely strained the city's resources and its health system was at the tipping point. As we all know that Delhi is the worst hit city in India with 25,500 fresh cases that came on Monday. So clearly you can see that the decision that was made by the Delhi Chief Minister Arvind Kejriwal was only for benefiting of the people, to keep the people safe, the residents of the Delhi safe, and to rebuild the health infrastructure which was tipping at this given point in time, because Delhi is witnessing more than 25,000 cases and 161 deaths in the last 24 hours. And I can tell my video journalists to kindly give you a picture in a sense that this is the entry point where the barricading has been done. Police officials are standing there ensuring that people without e-pass are not really allowed in the market area. They need to have the e-pass to enter the market area. Only the essential goods services is allowed. People from the judiciary are allowed in this particular lockdown, paramedical staff, and also the pregnant woman or any kind of patient needing any hospital services will be allowed. And if we talk about the COVID test and the vaccination in the national capital, people with the valid passes will only be allowed at the COVID center, and people who are not having any kind of e-pass or valid pass will not be allowed. So a kind of a strict lockdown that can be seen in the national capital amid the rise in COVID-19 cases in the national capital, because
right.
Delhi is witnessing a surge in the COVID-19 cases. Crispino,
stay with us, Mahima. Joining me on the broadcast, my colleague Amandeep from Chandigarh. Amandeep, we're also given to understand that a lockdown will be imposed on Wednesday in certain areas like Mohali, along with Panchkula as well. Do take us through this latest bit of information that we're getting of a lockdown, a one-day lockdown.
Exactly, Crispino. Tri-City has decided to put the lockdown on Wednesday, and in fact, no movement will be allowed except essentials and emergency services. This has the decision taken by the Chandigarh administration, Punjab government and Haryana government as well, just because the Tri-City is interconnected. So that is why they have decided to impose the complete lockdown for one day. In fact, even a day before the lockdown, I can show you the visuals that how the overcrowded market is still visible. People without mask, with no social distancing are here. This is sector 26 vegetable market, and these are the morning visuals. And in fact, Crispino, despite knowing that 612 cases reported positive in last 24 hours with 6 deaths, on the other side the administration claims that they are getting strict for the violators and even imposing fine without the mask, asking them to maintain the social distancing. Sanitization is very much mandatory, but nothing is visible here. Neither the people are maintaining the social distancing distancing, nor are they wearing the mask, and not even a single person from the administration to verify and to keep a check on this COVID violators, and nobody is here to impose the fines as well. This is how we will battle against the COVID-19 second spike. This is how we can fight against the COVID. This is not the situation. Just because this is another normal day, on the other side, the administration is preparing for the extra beds, for the oxygen supply, and even pushing the people go for the vaccination at the maximum level. And even the people here are not even able to understand the seriousness of this COVID situation, and that is why they are not maintaining the social distancing. Highly compromised city, highly compromised situation, and highly compromised market. This might be the hub of the COVID-19 infection spread, and this is very much telling that the cases are not going to halt at this number. Of course, this market and this crowd and without social distancing reveals that definitely the cases will rise again in next 24 hours, and the administration has to take the note on this, and even no administration official is present here to verify the violations of COVID protocols. This is how the people are not able to understand the seriousness of the COVID-19 when the nation is prepared to deal with the entire situation, but people has to take the initiative by maintaining the social distancing and wearing the mask to fight against the COVID.
Absolutely.
Yes,
India battles COVID-19, all seriousness thrown to the wind there at the market from where you are reporting. Joining me also on the broadcast is my colleague from Jammu, Gursimran. Gursimran, we are also given to understand that educational institutes have been shut till 15th.
Yes, educational institutes have been closed. This has been the decision that has been taken by the Lieutenant Governor of Jammu and Kashmir. But now the priority of the government should be to provide the resources, as Jammu and Kashmir government has taken a decision that it will be diverting all the resources from the private player to itself, be it the Feviflu vaccine or the remdesivir or the oxygen supplies. All the supplies have been diverted to the government institutional purpose use only, but that has to be seen, because as of now the occupancy rate of the beds in Union Territory of Jammu and Kashmir is somewhat 30 to 35%, and positivity rate is somewhat near 3%. But what officials are believing that in the coming days it will rise, and that will be the litmus test of the Jammu and Kashmir administration, because there are so many claims that are being made by the Jammu and Kashmir administration that they are in well position to tackle with this challenging situation. They have made it clear that the situation is really challenging, but when the cases will continue to surge, as in the past 2 days we have seen the number going up for above 1500, and this is for the first time since outbreak of the coronavirus that for 2 consecutive days the COVID numbers are above 1500. That means the situation is really worrisome. Though the administration has diverted all the resources from the private players to themselves, saying that they will equally distribute it when and wherever necessary, but that has to be seen when the load on the health infrastructure will increase, how the situation remains in the Union Territory of Jammu and Kashmir. Because if we compare Union Territory of Jammu and Kashmir to other parts of the country, the health infrastructure is not up to the mark, and that is really a worrisome situation for the administration as well. They are in a panic mode. Yes, new facilities have also been established, but we have to see how things goes if this number goes on increasing with this speed, because this surge, earlier Jammu and Kashmir witnessed the surge in the month of September, but this surge, this is way more than that one. Yes.
Absolutely. And joining me on the broadcast also is my colleague Madhurima, joining from Delhi. Madhurima, we have seen also various scenes yesterday of migrants leaving Delhi, as well as people queuing outside liquor shops as if that was the priority, given that Delhi is now under a 6-day lockdown. To take us through all the scenes that you have been seeing in the last 24 hours in Delhi.
Well, absolutely. In the last 24 hours, we saw a lot of shocking sights, including from people queuing up in front of the liquor shops to migrants once again believing in the rumors that this lockdown might continue more than Mr. Kejriwal has said. That is more than 6 days. They all want to leave because they're saying that once again they'll be thrown out of the jobs, and their apprehensions were somewhere correct, because we still don't know what will be the future of this particular lockdown. If we see results, there could be, more days added like we saw in Maharashtra. However, from today, the lockdown has begun, and I'll request my VJ to give you the view today. We are at the Vasant Vihar market. It is one of the most prominent markets in the South Delhi area, and it is one of the heaviest crowded market because here services start from 7 a.m. in the morning. But today you can see it's dead silence here at the Vasant Vihar market because the curfew has begun. This entire market, not a person will be seen because all in the national capital are complying to the rules set up by the Delhi government. As we know that the national capital is one of the major contributor to the entire tally of India and is contributing and has been contributing over 20,000 and many days over 25,000 cases to the final tally. You can even see the barricading has been done. The police officials here are checking and asking for the e-passes, that if people are out at all, why, what is the reason? And, you can see that police officials here are interrogating people one after another for their e-passes. They are checking why, if people are out on road, then why. If not, they will be penalized, as very strict measures are being taken all across the national capital, because we've seen the kind of lines, the queues outside several hospitals, the dearth of oxygen, the dearth of medicines. Looking at all entire of this situation, these steps have been taken, and this particular lockdown for 6 days has been called by the Delhi Chief Minister. He came out yesterday in a press conference and even announced that the positivity rate is as high as 30%, and to flatten the curve, this particular lockdown is necessary, and the people of the national capital will have to comply and do their moral bit to help the flatten the curve. Back to you.
Certainly a grim situation there in the national capital. Thank you, Madhurima, for joining us on the broadcast. Many thanks to also my colleagues Mahima, Kursimran and Amandeep.